combating stress and depression. Stress and depression on their own can create dreaded diseases like cancer, heart disease, or diabetes. They certainly worsen the disease in most of the cases. Even they create more damage than the disease itself. Secondly, the aggravation of the disease is very fast due to stress and depression. Unfortunately, the conventional medicine is hardly paying any attention to these factors. On the contrary, the approach of doctors, the rising costs of treatment, hopeless situation keep on aggravating these two. So, a vicious circle is set. More stress and depression leads to aggravation of disease and symptoms. That in turn leads to more stress and depression. Thus, the cycle continues. The cycle can be reverted as well. If one thinks positively, that leads to regression of stress and depression, causing further regression of the disease or symptom. This encourages the patient for more positive attitude. That further leads to more regression of the disease or symptom. Once this is very well understood by the patient, he or she can take proper steps to come out of stress and depression. Reasons behind stress and depression. There are various reasons behind stress and depression. We consider them one by one. 1. Why me? Different people with different backgrounds have this common question. If one is addicted to tobacco or liquor, has a strong heredity of cancer, heart disease or diabetes, has very improper lifestyle and food habits, if suffers from dreaded disease, should not get shocked. But even then, she makes comparison with people who have stronger causes with apparently better health. So, they don't accept these as the reasons for their disease. As a result, they get stressed and depressed. Other people having a comparatively healthy lifestyle or having no heredity or addictions, when suffer from such diseases, receive a tremendous shock. They really find no reason for their disease and become victims of stress and depression. 2. Shall I get cured? Having heard of experiences of many others, the fear of untimely miserable death works like a hanging sword over the head, especially in case of cancer. Even after hearing few successful cases and even after starting or completing conventional treatment, the anxiety keeps on creating stress. One becomes suspicious about minor symptoms of other diseases as well, with the fear of the dreaded disease. The doubt about aggravation or recurrence of disease constantly keeps him or her stressed. 3. What next? Even if a person is in disease-free state, he or she has the fear of recurrence or metastasis. What to speak about patients who are in a progressive state of the disease with hopeless situation? Having realized incurability of the disease and short lifespan, the question, what next, keeps on creating more stress and depression. 4. How to manage funds for treatment. Even a rich person starts fearing about the expenses for diagnosis and treatment of these diseases. What to talk about a common man? The expenses become more burdensome when there are no chances of recovery. One has to spend a lot even for a palliative care or for relieving pain. The financial stress further leads to depression. 5. What will happen to my remainders? The worry about remainders is a major cause for stress and depression, especially when a person suffers from these diseases in middle age, when there are so many responsibilities to be fulfilled. This stress is at its peak. Neither the person is in a state of thinking properly, nor does he or she have the physical ability due to progressive disease condition. But still, this thought keeps him, her troubling and under constant stress. 6. How do I find a way? When the disease is progressive and all doctors start expressing inability for any cure, or when they give predictions about lifespan, the patient and relatives both are under tremendous stress. They keep on gathering information from various sources and rush with a ray of hope to any place and person. The situation is really very stressful. 7. How do I face death? When the disease is progressive and death is nearer, this question causes tremendous stress. Everything comes to an end along with death. So, practically everybody wants to live longer. When one realizes that it's impossible to delay death now, the stress and depression take full charge of the person. After considering the reasons behind stress and depression, let us consider the ways to combat stress and depression in the same order. 1. Why me? Formation of a disease is a complex process involving many external as well as internal factors. It mainly depends on heredity, lifestyle, addictions, stress or worries, food habits, and even destiny. If the reasons are not traceable in this lifetime, one may have a link with deeds in the past life. One has to accept reasons which are traceable during this life. One thing is certain, that there can't be an effect without any cause. Otherwise, it will not be called scientific. Hence, one has to believe the cause in the form of a deed in the past life. This thought to certain extent relieves stress. Great saint like Ramakrishna Paramahamsa suffered from cancer. This example is sufficient to prove theory of karma, that is past deeds. The patient may satisfy self with a thought that he or she is paying off for his or her deeds in the form of suffering, and either he or she will get liberated or he or she will get better birth in the next life. If one becomes well aware of his or her mistakes in present life, there are greater chances for rectification in remaining life. At least they can set up an example for the remainders so that the remainders learn a lesson. 2. Shall I get cured? The question itself has a hidden answer. The question indicates that the person has a desire to get cured. This desire is very important. It arises from the mind, and mind has tremendous power to heal, even in advanced stages. One should never give up hope, as there have been many success stories about patients given up by doctors. Instead of asking, shall I get cured, the person has to ask, how do I get cured? One can use the power of his subconscious mind for the desired results. So, the desire for cure should never come to an end. 3. What next? This question also has a hidden answer. It indicates that the person is at least thinking about his future, and he or she wants to take some steps to come out of the situation. So, instead of just remaining anxious and worried about the future, it is better to take a positive steps. If one is in disease-free state, one should approach an Ayurvedic physician for holistic management to prevent recurrence. One may visit the website www.gadgilayurveda.com for guidance. Panchakarma and Rasayana treatment helps a lot to prevent recurrence or at least to delay it or reduce the severity. A change in attitude, lifestyle, food habits is much beneficial beyond expectations. If one is in advanced stage of the disease and the disease is progressive, one may redefine his or her objectives. Still, one may not give up hopes and try to contact eminent Ayurvedic physicians for cure. Initially, one may decide to concentrate on better quality of life and its prolongation. Even that is a requirement, and it can be fulfilled in many cases. But only honest persons should be trusted. Some quacks do take an undue advantage of the situation to grab money. So one has to be cautious initially before starting such treatment. Watch for positive, negative, neutral changes and then make a decision about further treatment. But once they know that the person is genuine, then should trust him or her fully and follow his or her advice wholeheartedly. The decision should be firm without any dilemma. The relatives, friends, doctors do keep on giving different advices as per their knowledge and experiences. Their efforts are honest. Still, they unnecessarily create confusion. One has to be very cautious about such advices. But even in a progressive state of disease, instead of getting stressed, it's better to redefine our objectives for better quality of life and try to achieve them. 4. How to manage funds. There are generous people and institutes who work for a social cause to make the investigations and treatment available at a subsidized cost or even free. Some institutions do provide free hospitalization of terminally ill patients. One can get information from internet, friends and relatives and doctors. One has to keep on inquiring about such people or institutes. It is better to make a visit to the place, have complete information and then only take the patient to the place. Even a minor concession given by any doctor or institute helps to some extent. Of course, affording people may not take undue advantage of such doctors or institutes. Many a times, people wish to spend any amount for conventional treatment like surgery, chemo or radiation, but they are reluctant to pay for much lesser amount for Ayurvedic treatment, which is really scientific. The main reason behind this is the mindset. Since conventional treatment has been established as scientific, one may spend a huge amount for that. A change in mindset will be possible only after a change in our educational system and propagation of the Indian sciences like Ayurved, Yoga, etc. right from the school level. 5. What will happen to my remainders? Again, the question itself is suggestive of the answer. The question should be taken in a positive way. If one really loves his or her remainders, one should come out of stress and depression and take positive steps to really care for them. The best way is to get relaxed and then decide priorities to fulfill one's responsibilities. If one is in middle age and is the only earning person, financial management and career of children and maybe of parents need urgent attention. Wife may take a lead to have some earning source through job or self-employment. One should use attachment for a temporary detachment. Then only one can think independently as a third person. One may try to explore options for scholarships for children for completion of their education. Some charitable institutes do work for this noble cause. Some senior citizen homes may take care of the elderly parents at a subsidized rate if one is in financial crisis. So, depending upon the situation, priorities should be decided and proper action should be initiated. 6. How do I find a way? Again, the answer is within the question. The very fact that person is interested in finding a way is itself a positive step. The only requirement is its conversion at a practical level for really finding a person or institute. One should keep on inquiring about one really finds a proper solution. One should keep on inquiring till one really finds a proper solution and then stop efforts and follow guidelines wholeheartedly. 7. How do I face death? Facing death as a patient or as a beloved person has been dealt in detail in the chapter Facing Death. One may refer that chapter for details. To summarize, it's better to know the reasons behind the stress and depression and use these ways to get out of them.